Welcome to Future Focus, the Next Gen OD Canada podcast, your go-to source for insights and inspiration as you navigate your optometry journey.
Whether you're a student or a recent graduate in your first few years of practice, we're here to explore the topics that matter: career paths, job opportunities, board preparation, and more.
Each month, we'll bring you expert guests and practical tips to help you thrive in the world of optometry. So, let's shape the future of optometry together on Future Focus, the Next Gen OD Canada podcast.
Dr. Nguyen, welcome to the podcast. We're so excited to have you here today. And for any of our listeners who are not familiar with who she is, you definitely will get familiar with her anyways, because you'll see her at conferences, you'll see her on social media, and you'll see her in the dry eye world if that is a specialty that you're interested in as well. But just a little bit of a background, Dr. Nguyen is originally from Ontario. She got her BSc at McMaster University and her Doctor of Optometry in Waterloo. And her clinical training included rotations across Canada. So she gained lots of experience in ocular disease, surgical co-management, myopia control, and specialty lenses. And right now she practices full scope optometry, and she has a very strong focus on dry eye management and myopia control. And she is definitely becoming an experienced educator and respected speaker across the nation, because Dr. Nguyen has now taught optometry students, and she lectures at various different conferences and for dinners about various eye care topics, but also mainly dry eye disease. And outside of optometry, she's passionate about her community service. She dances. I've seen those good videos too. And lots of outdoor adventures. Now that she moved to Vancouver with her husband, I'm sure she's going to have a lot more outdoor experience than in Ontario.
For sure. Well, thank you so much for that introduction.
Yeah.
Can you tell me what kind of dance you do?
Yeah, well, I just started actually when I was in Winnipeg because I had no friends and I really wanted to get myself out there. And I'm like, I'm going to learn something new. And I always love dancing. But, when we're at the club, it's not much. It's popping my head and
A little bit of movement.
yeah. I'm like, I want to learn something that will be fun to do. And I love music in general. So I started off with hip hop because that's my number one jam. And then I also branched to like jazz funk and heels and Afrofusion. It's been so much fun.
I love that.
And after this podcast, I'm actually going to go to a studio in Vancouver and try out a new class too.
Oh, yeah, because now you got to make new friends now that you moved again. You got to find all the dance friends there.
Yeah, exactly. I feel like it's so great to have a different community outside of optometry and outside of your family too. I just find that I learn so much from people and it helps me grow as a person.
Yeah.
I love that. I think we're so excited to hear from you about your journeys across Canada, how it's been. I would still consider you maybe a new grad or a young OD.
I think there's a lot in my store.
Yeah. Can you touch on how you build a loyal patient base from ground up, whether you're in Ontario or Manitoba or now Vancouver? Is it overwhelming jumping into that initial, new practice and having to find your people and your patients? Do you have any strategies that you would recommend to new grads?
Yeah, so I'll start off talking about when I first arrived in Winnipeg, or should I say Winnipeg, right? Alexa knows she was born and raised there, I think. So like I said, I had no connections. I didn't know any doctors, any ophthalmologists. I didn't grow up there. The only few people I knew were my classmates. Shout out to Jordan and Madeline. They were awesome in connecting me with people and just bring me up to speed in Winnipeg. But in my first month, in terms of dry eye patients, it was crickets because no one knew who I was. And you have to learn how to build that yourself. You can't expect the clinic owners to feed you these patients. I mean, they try their own best, right, with their own marketing, but we have to take the matters in our own hands. So I started off with trying to find dry eye patients from within my primary care patients as well. Because think about how many patients do you find in primary care complain about dry eyes?
Yeah, literally every day.
Exactly. There's a lot. So I can at least draw on those patients and at least start them on some at-home therapies and discuss other things with them if they require that. So always look at your primary care patients. Again, if you're trying to build that specialty, right? VT, I'm sure, Amrit, you see so much children with problems as you do cover tests, as you do case history every day. And then the next thing I found was that I would talk to doctors in the office. And some clinics I worked at maybe had a couple, maybe 4 to 5 doctors. And some of these doctors mainly focused on primary care. So I would tell them like, hey, if any of your patients, if you're managing their dry eyes and it's not getting any better, it's not really budging with steroids or at-home therapies, and they keep coming back to your chair, well, I can help you out. Just to let them know that there's support on the other side and there's support within the network. So I find that talking with doctors within the clinic is something that's really great to build referral bases. Now, let's say if you don't work at a clinic with a lot of doctors, you have to take the next step and go outside your clinic now. So you have to go discuss cases with doctors who are maybe in a different city, or meet with family physicians and tell the family physicians what we do. My one clinic back in Oakville, there were family doctors right beside us. And I would just pop in during lunchtime to speak with them about what we do. We do diabetic exams. Hey, we can see kids' exams. If someone has something in their eye and if you don't feel comfortable, send them over. We'll help out. So it's just building that drive to speak with people and just to let them know what we do. And in Winnipeg, there were some events where we would speak with ophthalmologists. And right there, they're right talking to you, talking about their own surgeries and what they provide. So, hey, it's a two-way street. You can also tell them what you do too. So I find that you just have to really put yourself out there. And as long as you have that drive and ambition to get these patients, they will definitely come in your chair because you're going to be an amazing doctor providing that care. And that will just slowly turn around from word of mouth too.
Yeah. I find that another great tip to add to, just finding patients within your own practice, right? Especially, as a new grad, you're so right. The clinic owners are going to do their best to try to market if there is a specialty that you're offering in their office. But for the clinic owners, I mean, they already have so much going on in their own lives and in their own career that they're not going to be just handing you patients. But they're likely going to have a huge patient database. And I find that for dry eyes, did you use any like survey or anything that you, like a handout that you gave, especially to the other associate doctors that were in that clinic, just to hand out to their patients if they had like dry eye symptoms, for you to then screen them and say, okay, this is a great opportunity for you to see our other doctor in the clinic who offers these services?
So we would have like a doctor dinner where all doctors would showcase what they do. Because some doctors would really heavily manage glaucoma, or some doctors might heavily manage myopia control. And each of us would go through a stepwise approach. So I would tell the associate docs, like, hey, if you are managing your primary care patient and you've given them all these at-home therapies, and if you follow up with them in a month and they're not getting any better, that's how you know that they need to go to the next step, which referral for in-office care. So I did give them a step-to-step, but I didn't want to take that autonomy from them too. I wanted these docs to also take care of their own patients. I didn't want to be like, hey, give me these patients. I wanted to help them in that approach. And I always said, hey, if you want to try advanced dry eyes, let me know. I'm so happy to teach you too. So I think that as long as you're willing to have that collaborative care with other doctors and having the main goal of helping your patients, it'll be really easy to build out that patient load.
Yeah, that's great advice.
I think one of the other things too that a lot of people don't realize, especially new grads, is it takes time to build a patient base. It's not going to happen right away. It's not going to happen right out of school or when you enter a new clinic. It's word of mouth referrals, and it's building that rapport with your existing patients or your new patients. So they return for follow-ups and return the next year and the next year, and they bring their kids. And so there's time and patience involved in that too.
Yeah, what's that one quote? Rome wasn't built in a day, right?
Yeah. I feel like that quote is so irrelevant to this newer generation that has no patience at all.
They're like, give it to me now. I want this.
Right?
ChatGPT it.
Yeah. And so, speaking of just building our patient base, like you mentioned, one of our patient bases can be from referrals. And so, what advice do you have for new grads or young ODs who want to grow their referral base but don't know where to start? I guess maybe it's more specifically for a dry eye specialty. Where would they really start for their referral base outside of their own practice?
Outside of their own practice. So you should try to maybe reach out to, this is where we'll talk about reps and how the industry can connect us and help grow our practice. But if you can try to do dinner talks, small dinner talks, maybe start off with like some of your classmates or colleagues that you're more comfortable talking with. Discuss cases with them and share your knowledge. Because at the end of the day, maybe these doctors don't know what else is out there. And as their close friend or close colleague, you can educate them about this, and then you can build up that network. And of course, if you're feeling more comfortable, like you, Amrit, like speaking more to a bigger crowd, right? And I think that as long as if you have that support to go out and talk to people about what you can do, that's where it's going to start off with. And it doesn't have to be a really, really big talk at first. Again, small talks, right, with colleagues or friends. And social media really helps too. And both of you guys know that. Explain what you can do to your patients and to other doctors that may not be able to attend talks.
No, you're so right. Like, even through social media, I feel like I've had more optometrists refer kids to me for a BV assessment, and I've never met these ODs ever. Like, I've actually never connected with them in person, but they find me through social media. I'm in their neighborhood, I'm in their area, and then they end up referring. And that's like, it's almost like it's not minimal effort. Social media is a lot of effort, but it just feels like less physical effort, right? Of like going to another practice, going out, dropping off your forms and your info and all of that stuff.
Yeah, so I definitely think that both of you guys are leveraging social media so well, and that can definitely bring in patients, and also docs are becoming more aware of what you guys could do.
Yeah, I think there's still a little bit of resistance with, I'm not going to generalize all ODs, but some ODs with sending their patients to another optometrist. I think that's a barrier we're still trying to get over. And I almost want to share how we can prevent, stealing your patients.
Yeah.
How can we voice that to other ODs who might be a little bit nervous about sending off their patients?
Yeah, that's a great question, Alexa. When I actually first started off doing dry eye in Winnipeg, I got that backlash a little bit. Like, some docs were like, hey, just so you know, there's not a lot of internal referrals within the optometry community here, just so you're aware. And I was a bit taken by that because in Ontario, everyone, right, pretty much does it, and they're so supportive. So I kind of found that as like a challenge, like, okay, all right, we'll see how this goes. And again, at the end of the day, I just wanted to make sure to help as many patients as I could. So I think it started off with a couple of colleagues trusting me first, getting that initial trust. I would speak to them about cases, and they would ask me questions. They'd be like, hey, how could I help my patient? And I would text them. I'd be like, okay, you can try this, this, this. If it doesn't work out, let me know, keep me updated. So they knew that I wasn't trying to initially obtain this patient. I was just trying to make sure this patient was getting the right care and feeling better at the end of the day. And my colleagues would try it out, my recommendations, and they would also do their own management, and I wouldn't get better. At this point, they're like, hey, thanks for all your help. I think this is something I want to refer to you now because I know that you're doing a lot more advanced things. How can I refer? So that's the first step, building that relationship, helping your colleagues. And of course, your colleagues also want to try to help their patients initially first. So I find that building that relationship was very important. And when the patients came to me for their dry eye consults and their dry eye treatments, I reiterated, you're seeing me for dry eye. You're going back to, let's say, Dr. Diker for your primary care eyeglass contact lens wear. If you have concerns about that, you're going to see her. Dry eye is only me. So I told my patients up front. And I always send a letter back to my referrals. And at the end of the letter, I also tell the doctor that I also recommended our mutual patient to come back to you for primary care needs, glasses, and contacts. So there's that open communication both ways where I'm telling the patient, but also letting the doctor know too.
Yeah, that's great. I think that's a really good piece of advice there is sending a report back and specifying that they will come back to you. And ultimately, it is up to the patient. Like if someone wants to switch, but you have to do your best to initiate that transfer.
I think as a new grad or a young grad where you might not own your own practice and you're just an associate, I guess it would be hard to control that situation. Like if you just accept a referral and then the patient loves you and then like wants to come to that office, you might not have control whether or not, new patients can be onboarded to the practice, but share those concerns or those situations with your employer, with your front staff to be like, hey, by the way, this patient should be a do not recall patient. Like we are not calling this patient back for routine eye exams because we want to respect that relationship. And I've had those awkward moments too with VT where I've had some families very, very happy and they want to, move their files to my office. And you have to just make a very clear stance and let them know that, I really want to respect the fact that your eye doctor was good enough to identify something and then send you to the right person. So you actually already have a really good eye doctor like in your pocket, like that you should stay with them because they've already done the best job to identify a problem that maybe other eye doctors would not have said anything. So, just try to like stand your ground, but then, talk to your staff members to make sure that it's okay to do that and that you're not ruffling any feathers. See the science. With over 25 published clinicals, Thialase Duo is one of the most studied artificial tears. Clinically proven to reduce inflammatory markers, improve tear film thickness and stability, and improve patient satisfaction scores, including OSDI, Thialase Duo is designed to mimic natural tears. See relief. Kind of moving on to building relationships, and you already just kind of brushed upon this, Diana. Your reps and your relationships with your reps, especially in the dry eye world. How have industry connections and your rep relationship supported your career growth? And what advice would you have for new grads on how to build a more meaningful connection with their rep so that it's not so sales-based and transactional?
Yeah. So tell me if you guys had the same experience, but the main thing we cared about as students about these industry meetings were what? The food. Yeah, I love this, right? Starving students down here. I'm like, Kate, they're coming, but what are they feeding me?
Yeah.
There's just so much more than just that. So I would say with new grads, if you're nervous about it, just at least have that initial lunch, that initial dinner. I mean, you're going to have food anyways. And what's really important though at that meeting is that these reps will share their knowledge with you. When we're new grads, it's really overwhelming, right? We have to learn how to see patients from 1 hour to 20 minutes. We have to learn how to counsel and manage all of these patients. And the last thing on our mind is to learn about product recommendations because there's just so many. And in school, they don't really go over that. They go over mainly diseases, right? And then what antibiotics to use and who to send to. So it's hard to know which products are a best fit for your patient. And patients will end up asking you these questions. Which drops should I use? What is the best thing for me for my eyelids? So I would say get out of your comfort zone to these industry talks or to meet your reps because they're a great way to learn about knowledge and cases because you'll also meet other docs there. So it'll be a great way to learn everything and apply it back to your chair. And with these reps, there's so much new products on the market as well that they'll share their information with you. And the reps that have the same aligned goals as you, which is helping your patients, you will lean into these relationships more often. Not all reps are the same, right, you guys? It's just...
Yes. Oh, yeah.
Yeah, like some reps are literally just there to make sure you purchase their product. And you can see that it's not genuine. And you get that feeling like, I don't know if I want to build a relationship with this rep. But for those that are proactive, they drop in, they say hi to you, they get to know your staff. They ask if you need any help. How can I help your practice? Do you need any information from me? Those that are responsive, those reps are the ones that are supporting you and also supporting back to the optometry community and supporting independent optometry. So I would say try to lean into those relationships more because, yes, certain reps will only care about business and a number, but you don't want to build a relationship with those reps. And, I've had great experience with reps from Thea. They've supported me so much along the way with not only my career, but with practices as well, the different practices that I've been with.
Yeah, no, I think fully connecting with reps is so cool. And I agree. Like for example, I've been at a few different practices and I've actually, had the same rep move, or I've moved with the same rep kind of. So I actually had the opportunity to introduce Thea to the clinic I'm currently at. They didn't even carry the products before. And when I came in, I said, I really stand by these products. The support from the reps is huge. And ever since, we've been really successful with them. So don't hesitate if you believe in something, bring it to the owner. They probably will value your opinion.
Yeah.
Hopefully.
No, I agree. I feel like the relationship with our reps, especially Thea too, like even for us, we have a very positive experience with Thea. And our reps are just very supportive in not only just, educating us on how to promote their products for the patient, but just how to promote our own practice. Like I remember Thea really stepped it up when we had our grand opening at Northern Site. Those are the reps where you really know they care about you, where you're not selling any of their products. You're just having a grand opening. You're having like a big party just to celebrate the fact that you've opened an independent practice. And that company was right there front and center being like, let's give away these little goodie bags like for patients, just so that, or for people that come in, just so that they know, that you have these sorts of products available, that you treat dry eye disease, all this stuff, all the pamphlets, all the brochures, the information. And they were just really helpful. And then I feel like ever since that grand opening, we've always had such a strong relationship with them. And you're right, it does help us to kind of boost our practice just to make us feel more confident selling those products. Because, yeah, as a new grad, you don't want to sell things, right? Like you said, we learn only about disease in school. So the minute we're out, where our mindset is so medical of just like, I just want to treat things and see you for an eye exam. And I don't want to pretend like I'm a salesman selling products. But the reps, when you start to connect with them, they help you to understand that the products that you are selling are the products that are helping to treat the patient and to make the patient feel better. So when you have good reps like that, you're never going to feel like a salesman or that you're stuck trying to like make profit and sell products. It just doesn't happen that way.
There's tons of scientific based evidence as well with products. So it's great to have that scientific background where you can showcase it to your patients as well and go through that evidence part. Another thing I want to touch on is that it's so great when they can teach us about these products, but now I want to teach my staff. And, staff are an extension of you. So I found that they've been so supportive, having teaching opportunities for staff. They'll be like, hey, let's do a lunch and learn. And the staff always really enjoy that. It's great for them to learn about the products because we're making those recommendations quite a bit. And it's a nice refresher for them. And they always enjoy the social aspect of it as well. So I think that's one thing that I find to be really great to support the practice.
Yeah. I want to pivot a little bit into choosing a clinic and how to pick a clinic that supports you and feels like the right fit. I know you've had to choose many different clinics to work at, and I'm sure now you're able to be a little bit pickier. But for new grads, what would your advice be to them in choosing clinics that fit their goals and support them?
Yeah. Have you guys seen that chart where it's like the hours spent per day with your friends versus your children versus your coworkers over the years? Have you
No.
seen it?
Yeah.
Okay, well, the friend graph, it goes high when you're young, right?
Oh, yeah.
And it goes down as you get older. The children graph is high when you first have your kids, and then it starts to go down as your children become their own person and have their own families. The only graph that is consistent throughout your whole life is your coworker graph. So it's always high. You're always spending the most time with them. So true. So a great clinic that you should work at has an outstanding staff culture and doctor team. They are going to be the foundation of excellent patient care. Think about tree roots, right? There's the tree roots. If the foundation isn't strong, then the tree can't grow to as big as it can be. So we see patients in the room for about maybe 20, 30 minutes or so, but they have other experiences in the dispensary, front desk, right? And they spend a lot of time with their staff. I think that's really important to work at a clinic that has a great and positive staff culture. I love coming to work and having a good laugh with the staff and working together to solve a problem. We're always sharing treats and like sharing family stories. So that's a really big green flag if the staff culture is positive. Now, I'll let you guys add on to that until I go to my next point if you guys want.
I totally agree. I have nothing else to add. That was like perfectly well said.
Yeah. Well, depending on the new grad, I'm assuming they want to work in private practice. So if you want to work in private practice, I would try to look for a clinic that is extremely supportive of things that you want to pursue. Hey, if you want to pursue dry eye, yeah, this is something that we are interested in the future. Maybe the clinic owner wants you to give them a game plan of like what things are needed. So if you're interested in specialty care, find a clinic that is willing to support that or find a clinic that already has that. So when I moved to Winnipeg and Vancouver, I made sure to find clinics that had dry eye in-office equipment already or wanted to grow that practice even more because that was something that I was passionate about and I wanted to do. In general, if appointment times are like 10 to 15 minutes for a full eye exam, I would say that's a red flag because one, there's no time to build that relationship with your patient. And you're definitely skipping stuff in the exam.
Yeah, 100% I agree. That was so well said. I feel like all three of us are probably pretty biased in our opinions just because we all also work in private practice settings, right? And we all thoroughly enjoy specialty care. But yeah, man, 10-minute, 15-minute eye exams, I don't know how anyone does it. I take like 45 minutes, 30 minutes to 40, like they're booked for 30. But I'm in my exam room for like 45 minutes with each patient. And I do the exam in like 15 minutes, but you're just chatting up with them, building that relationship, asking more questions so that you can screen them for the specialty services. And even if they're not going to sign up for that IPL machine this year, you have to build it up, have that conversation, educate them on what it is so that next year, when they're still complaining that their eyes are burning, then you can bring it up again and be like, remember when we spent 45 minutes last year talking about it and I ran behind and my whole staff was really mad at me? Yeah, we're going to do that thing that we talked about last time. And that's honestly how, going back to referrals, when we were talking about building a referral base as a new grad, talking to your patients and building that relationship with them is going to build that word of mouth referral base too, right? Your patients are still using Facebook, surprisingly. I'm very shocked that people are still using Facebook groups to really like chat and like get around, but people are sharing their experiences in Facebook groups, in WhatsApp community groups. Like people are talking behind the scenes of which doctor to go to for what. And you want to be the name that is circling around in those private chats. And so, yeah, spend the extra 10 to 15 minutes talking to your patients. I totally agree with that. 10-minute eye exams, no.
Yeah, and control that narrative, right? Like, so they don't go on Google and find out what they can do for dry eye, like random stuff. So control that narrative. Make sure that the patients know what they need coming from you. And I will add, if you're a new grad and you know within 6 months that this clinic isn't working for you, leave.
Get out.
You can't. It is not worth it to stick at a clinic where you don't enjoy working, right? Remember that graph. You're going to spend way too much time there and you're going to be miserable. It's not fair for yourself and for your patients.
Mm-hmm. Yeah, very true. And then this was great advice. Honestly, I love this whole conversation. I feel like we could talk about this for hours, but we do have to wrap it up because we don't want to lose the attention of the young ODs that have no patience. So, looking ahead, Diana, what trends or shifts do you think will ultimately shape the future of independent practice and your career in independent practice?
I think that one thing that will be integrated into optometry is most likely AI. Care One is one, it's a remote teleoptometry thing that doctors use to send over fundus photos, OCTs, all of that to get a second opinion or maybe get a diagnosis of things as well, like diseases. So that is really going to be helping optometry and also integrating AI into maybe scribing. Like imagine how many time we take doing charts, right? Like imagine if you could have an AI chart just doing all of that, then you can spend more of that time speaking with your patient and counseling them.
Yeah, totally.
Yeah.
I was just talking about I need an AI scribe like tomorrow.
I know.
Yeah.
My husband is like really itching to create like a new EHR system for me and like to incorporate AI. And I'm like, I would love that. But just to think of how much work that's going to take, I was like, no, I can't take on another project like that. But I can't wait until somebody else makes it.
There's people coming out with some things.
I know.
I've
I was
heard.
like, you know what? I'm not going to do it. I'm going to wait for somebody else to do the work for me and then I can enjoy the final product.
Exactly. So yeah, I think that AI is going to be really integrated into our work. Not going to replace us, but to help us be more efficient and spend time with our patients. Specialty care, that's been booming for years, and I think that's going to continue to grow. So it's great that a lot of new ODs want to grab on to doing these new things. So as a new grad OD, I would say primary care is your bread and butter, but try to find a niche that speaks to you so that you can differentiate yourself and so that you can have a different patient load as well, right? You'll learn new things, see new things every single day.
Thank you so much. We loved having you on. And if you want to shout yourself where people can find you or email you or ask questions, share with the audience here.
Yeah, for sure. So you guys can always reach me at my Instagram at idoc.diaries. Or you guys can send me an email with any questions at dnguyen.optom@gmail.com. So yes, if anyone has any questions or anything that new grads, seasons ODs, my door is always open and I'm always willing to chat about eyes and even stuff other than eyes, right? Like come do a dance class with me.
Yeah. That would be so fun. I will watch you because I'm very uncoordinated.
I will.
Yeah, I am not.
Have you tried Blephederm yet? This eyelid and eye contour cream is clinically proven to provide patient benefits after 28 days. Speak to your Thea representative to learn more. Thanks again to Thea Pharma Canada for their sponsorship of the Future Focus Next Gen OD podcast. Thanks for tuning in to this episode of Future Focus, the Next Gen OD Canada podcast.
You can find us on all major podcast platforms, including Apple Podcasts, Spotify, and Google Podcasts. For episode summaries and more resources, visit us at eyecarebusiness.ca.
Be sure to follow Next Gen OD on Instagram, Facebook, and LinkedIn for updates, news, and more insights into the world of optometry. Don't forget to check out the show notes at eyecarebusiness.ca. Until next time, stay focused on your future.